All right. Hi, everybody. Welcome in. We're very excited to have you here with us today. I'm going to give just a little time for people to join. So while people are joining, can you go ahead and type in the comments where you're joining from, what your first name is, and because we just like to see, where everyone's coming from across the country. Looks like we have some people from Ohio, from Portland, Oregon, Oklahoma, New York City. Nice. See some familiar names. Oh, wow. Okay. People from all over. I'm in Connecticut, so I'm close to some of you. Some Rhode Island and New York people. Nice. All right. Well, people are going to continue joining. We'll keep seeing where people are from, but just to be mindful of everyone's time, we're going to get started. So to introduce myself, I'm Chloe. I'm a marketing associate here at August Schools. We're really excited to have you all here and to start on this webinar today. And today we actually have clients who are very familiar with August, and then we have people that are completely new to August. So for that reason, I just wanted to give a bit of an overview of what August Schools is and how we work with nurses. So let's see. We are an EHR built specifically for K to 12 schools. August Schools has one-click charting, so it allows you to quickly document things like visits, screenings, medication administration, and August keeps records secure and centralized. So then your student health record is organized and compliant. There's powerful analytics and reporting that's built into August. So you can track trends in your school, you can advocate for better student care, and you can share data with leadership through that. We've seen different schools, leadership at schools that were able to advocate for more staffing based on that data and showing it to leadership and based on specific student needs at their school. So there's like specific graphs that show exactly what are people coming in for, how frequently are they coming in, and then the gaps become pretty clear in that way. And there's also been health services directors that have told us that they were able to track illnesses in their school, like the flu, and be able to make decisions to best manage that illness based on data from August as well. So it's very useful. August is trusted by thousands of nurses nationwide, and the main thing is to help save time so that you can focus on caring for students. So then on to today's webinar. It's centered around data preparedness for end of year reporting in your health clinic. I'm very excited to introduce both Laura and Bethany, registered nurses at August, and they both spent years in school nursing, so they have really useful insights ready to share with you. So with that, Laura and Bethany, would you please introduce yourself and just a bit about your background?
Yes. So I'll go ahead and introduce myself first. For our current clients, many of you know me as the resident nurse here at August Schools. For those who are not a part of August Schools, I was actually a client before joining the August Schools team. I used August Schools at the school that I was at in my nursing position. And for me, data has always been something that I've always wanted to collect. I feel like it makes, especially in school nursing, even in any really setting for nursing, the data points kind of show you what you're doing best and maybe what you need to work on, as well as to help you find trends in certain things. So for me, August Schools was a great addition in my clinic setting. I was able to use the data to see how many students I was seeing over the course of the year, how many students were having to see other people at the school, maybe the front desk staff or things like that, because I was being pulled in multiple directions, and allowed us to kind of sit down and really look at if we needed another nurse at the school or another full-time position. So there's a lot of things that data can do. Not only we're going to talk about state reporting, why that's important, but then also other things that you can do within the platform. And that's just my passions, and why I'm actually here at August is because I really enjoy finding that data and finding those points that you can kind of connect to and see how you're spending your school year. I'll hand it over to Bethany. She's going to walk you through the first half of the presentation today, and then I will walk you through the second half.
Thanks, Laura. So my name is Bethany Boffman, and I am really excited. I'm one of the newest members of the August Schools team, but I also have a school nursing background and have now been at August for about 6 years. Before that, I worked with another EHR company, but I'm excited to get back to my pediatric roots. The reason why I have made the transition from clinic nursing over to working for an EHR is that using one in my clinic setting really allowed me to drive positive change throughout my school community. It helped me become a better clinician by looking at documentation in the past and how that drove my practice forward. I'm excited and I love that I get to help other clinicians in this role become more efficient with their workflows and their documentation, because we all know that we don't do EHRs or use EHRs for fun. We use it so that we can do what we love best, and that's take care of our kiddos. I too have seen firsthand how data can drive change on in our communities and on our campuses. So I'm excited that I get to help others do that as well. So I'm going to go ahead and get started with our slides here. So the learning outcomes that we have or want you to kind of take away today after watching our webinar is that we want you to be able to identify the data that you want to track at your school. When you identify the data that you want to track, that really does help you drive the setup and moving forward. We want you to be able to structure your data collection in a way that helps you prevent gaps in your reporting from year to year. Laura's going to talk a little bit about the National Association of School Nursing worksheets and how to use those to plan and or utilize your data collection in the best way possible. And then, of course, we want to highlight that you can utilize August Schools to reduce that manual work that you might have with reporting. In my experience, before I had an EHR, it used to take me 2 to 3 weeks to do my annual reports. Once I had an EHR, it only took a couple of days to get to what I needed to. So utilizing your EHR to get to the important data collection points for you is incredibly beneficial. And so first off, who benefits from data collection? I mean, we as nurses, obviously, we benefit from our data collection, but utilizing your EHR to collect information can help you with lots of different opportunities, from funding and reporting to your state agencies to your administration, helping them understand the value that your program brings to the school and the community. It can help you track trends on campus. I've got one school that recently reported that they utilized the data that they collected in August Schools to see when periods of high stress were, then proactively run programs that helped their students reduce their stress levels, bringing in support animals and doing programs like meditations and things like that really helped reduce the stress levels in their school campus at specific times of the year. And then, of course, utilizing the data will help your community as well. So those are some of the highlights there. Now, for nurses, it's important to understand some specific thoughts related to data collection. When we're talking about data collection, we want to make sure that we aren't collecting too much information, making it a burden on ourselves and our peers and or the family members that we work with. We need to be practical and reasonable with what we're going to, the data that we want to collect. We also want to make sure that we are standardizing the data collection both from year to year so that we're comparing apples to apples, but also from clinician to clinician. We want to make sure that we're documenting the same things the same way so that we've got those same data collection points that are standard across the board. That kind of leads right into making sure we're aligned on key definitions. What my administration wants to be reported on, I need to make sure I'm collecting in a way that is meaningful to both parties there. And then we need to make sure that we're not recreating the wheel when it comes to data collection. Sometimes we collect information in a different information like our student information system, so we don't necessarily need to collect that within our electronic health records as well. So that leads into what type of data can nurses collect? Well, really, the sky's the limit with the data that we collect. When I had to do it manually, I collected certain things on a big spreadsheet, a piece of paper, and we all know that spreadsheets and those types of information aren't necessarily HIPAA compliant. So we want to make sure that we're collecting information that relates to our students, both physical and emotional health. We can report on things like injuries and office visits and their attendance statistics. And each of these data points actually can help us improve our clinical decision making, support our compliance and reporting needs. They allow us to give more targeted care and streamline workflows. We all know that we want to be more streamlined in what we do so we can do what we love best, and utilizing our data collection to help make that more simple is going to be one of the best ways to, or how we can drive our data collection, right? So utilizing an EHR can make data collection analysis and reporting easier. As healthcare providers, we can look for trends in our system. I know that in August Schools, there's graphs and analytics that allows us to be able to see health trends. When are we seeing more of certain things, or are we seeing playground injuries at different times of the year? We can securely manage our documentation. Again, I mentioned that other forms like using Google Docs or spreadsheets or things like that are not HIPAA compliant or FERPA compliant. And so we want to make sure that we're utilizing a secure manner to document our health information. And then we also can utilize the EHR to communicate those encounters and statistics with our families in a secure manner as well. We can use it to document medication administrations and develop care plans for our students and our families, as well as seeing the demographic information about our students quickly and easily. So with that, I'm going to turn it over to Laura, because she's going to start with a very important concept, meaning we got to think about the output before we think about the input. So Laura, take it away.
All right. So the biggest thing is, like Bethany said, is output before input. So what we all want to do is we want to start with, what is it that we are trying to report on? If you try to, at the end of the school year, collect all the data without having set your data points at the beginning of the school year, you're going to be weeding through a lot of different things to be able to find exactly what you need. So we always want to start with that one report, that question, whatever it may be. So if you have your state report in front of you, because each year the state reports are typically the same. There may be some small changes from year to year of what questions they may ask, but in my experience, the state reports pretty much remain the exact same. So you know the types of questions that they're going to be asking. With those questions, it's good to look through them and say, okay, I need to collect this information. What would be the best way to collect that information? From there, you're going to, like I said, you're going to define that data collection. You're going to decide exactly the best way in your practice to be able to have consistent data that comes out of what you're collecting. And then you want to make sure you're collecting it in a meaningful way. So when you build a report, you want to be sure that you're building a report to just give you the information that you need and not extra information. So if you're just looking for one data point, you can look for just that one data point. But then also, if there's maybe a data point that you could look for two things on, you could make your report so that it could report both of those things for you, to be able to only run one report with the exact data that you're trying to pull out. From there, if for those people who maybe don't have an electronic health record system, you can still collect data electronically. I know Bethany was talking about HIPAA and FERPA compliance, especially when we're recording information. So when you record information, you do not need to record student data. You can just record the data points. So that helps you keep it FERPA and HIPAA compliant because you're not putting any student information into a Google Sheet. You are just putting the data that you've collected. So one important resource here is NASN has a Every Student Counts sheet, and I'm going to see if this will let me click into it. I'm going to click into it and maybe share my screen here. Probably will be the easiest. But on there, they have a worksheet here. Let me just share my screen. Sorry, I always forget. Here we go. So here you can see, this is NASN's National School Health Data Set. This is a part of their Every Student Counts campaign that is collecting, that provides worksheets. This is just one example of a worksheet that is on the NASN website that they help you to collect specific information for state reporting. So most of your state report details are actually given to NASN to collect, to be able to go state by state, nationwide, to collect information of public schools versus private schools. So all of that data that you're collecting for your state report, it does actually go somewhere. I know a lot of us don't like to report on that information just because it is cumbersome, but just know it's not for naught. You're collecting this data to be able to see the differences in different areas of the country of what they're seeing at their schools and what kinds of conditions and things like that students have. So this is just one of the worksheets, and this worksheet is actually, as you enter information into it, so if I were to come into here and enter information into this, it's actually going to total these. It's a interactive worksheet for you, so you're not having to total these types of things. So this is a weekly tracking of your dispositions, of what happened to your students in the clinic. So this would be an easy way, if you do not have an EHR, to be able to track each week here of information. So it gives you up to 5 weeks of information, and then it gives you the totals here for your month. From there, you could come over to the bottom tab here of the year and add in those numbers for the month. So if we're in the month, that was the month of February, I could add those totals in here to be able to have that information for my month collecting. So then at the end of the year, when I'm going to fill out that state survey at the end of the year, I would have all of my totals summarized here for me, and it would be an easy way to collect that if you do not have an EHR currently. So again, NASN has a lot of resources under their Every Student Counts. For those of you who do not have EHRs, for you to be able to start collecting data. And again, this has no student information in there. It is all just data points that we are collecting. Coming back, other things that you can do is you can make sure that, again, starting at the beginning of the year without a EHR, of just knowing exactly that information that you need to collect. Most of it is about medication administration, chronic conditions, as well as dispositions, and then staffing at your school. So you could collect those data points anonymously within a Google Sheet to be able to help you compile that for the end of the year. Next up, does my data match what we need? So that's going back to that output and input. So this is just a quick snapshot of how August Schools does give this information. So that same information that we were just looking at in the NASN Every Student Counts, these are all dispositions within a environment of options of how the student left your clinic. For this, this is one of those things that you would want to set at the beginning of the year. So if your state report asks for a specific type of disposition, it would be wise to set that at the beginning of the year. Now, if you are an August Schools client, that is something that you can work with your customer success manager on, of making sure that your dispositions match your state report so that you can quickly run a report and have all of this information right there for you at the end of the school year. We do have a clinic summary that does allow you to quickly access these types of things, such as dispositions. You can see how many students you have encountered for the school year, how many encounters you have had for the school year. You can also do it by grade level. You can break it down by practitioner, those who is seeing students within your school. And then the other thing is you can also look at medication administrations, because that's another big one typically on state reporting. Did you have to administer any emergency medications? Those are all options within the August Schools platform that you can quickly report on at the end of the school year by using our clinic summary tool. Kind of changing gears a little bit. So we've talked a little bit about state reporting and how to do all of that differently from state reporting. Sometimes we want to track different information. So this is one of a case study that was done. So tracking communicable illness. So we've had a couple clients come to us about how they can track illness within their schools. So there is the option under chief complaints to put in, a different condition, such as all of these listed. But then this is also a separate template that we built out for a couple of schools, or that schools built out in their instance with the Encounter Builder, to be able to add in or to have as its own type of encounter. The reason we built this out separately was so that you could use confirmed diagnoses. So most of the time in the clinic, unless you are actually testing your students for any of these, they're typically reporting back to you that they have a communicable illness, that the reason they're not at school, whatever reason it may be. So the reason we broke this out of maybe the chief complaints part of the encounter is so that if a parent called in, you could open up this and just put in what the student was diagnosed with. The nice part about this is that it was not only collecting the diagnosis, but it also, because you were using a student, assignment, everything like that, all of those demographics about the student were coming along with it. So steps in collecting this type of data, you want to make sure that what your data points are. So in this situation, it was these different conditions of communicable illness that the school felt were important. Step 2 was putting it into the environment to be able to quickly document this data on students. And then step 3 is the reporting on the data. So I'm going to show you a few slides coming up of the data. Now, for for schools, they could track this over time for the year total, or they could look at certain weeks of this data, or even months. So in the August platform, you can break down your ranges of when you want to look at like what time frame this data was collected in to be able to get that information. So on this next slide, you can see this is the reporting of the data. Here with, it's kind of hard to see, but you can see on the first one under reporting, that is communicable illness by grade level. So that was a year total broken down year to date of all of the grade levels that had seen communicable illness within the grade level. So it's a nice little quick visual there that you could see that your second grade and your fifth grade had higher levels of communicable illness. Now on the right, I know my picture is kind of covering up a few of those diagnoses there, but you can see that strep was the major component of communicable illness at the school in that year total. And you can also see that there were other conditions that did come up, but strep was the big one there. And then we can also break that down even further. So we can look at that information by grade level and by type of illness. So you can see here, I've highlighted the fifth grade on this screenshot. You can see that that grade had a high level of strep year total. And you can also see another grade over to the left side, I believe that was grade 2, also had a high level of strep as well. So you can break it down to see what you're seeing in the grade levels, but also your whole entire school as a whole to be able to make those types of decisions, especially around attendance. It's been, most schools do not like to close for illness if they don't have to, but it falls on the nursing staff to report on illness. So this is an easy way to be able to kind of track that information over time to see exactly where your students are falling if you do have confirmed diagnoses of certain conditions. So key takeaways from today is begin to determine your reporting needs and goals. So pulling out those state reports for this year or even next year to be able to start looking at what data you want to collect. But also start thinking about what you can do to what you can collect to help August or to help your school understand your needs of what you need to be collecting your data on. So if there are certain data points that you want to collect, certain things that you want to collect, start thinking about how you would collect that information, how you could add it into the system, how you could add it into an encounter to be able to collect that information in a more clear and concise way. Don't let the lack of not having an electronic health record stop you. Like I said, there's many ways that you can collect data with anonymously so that no student data is being collected at that time. And then We would encourage any current customers that have questions about data collection to contact customer success. We would love to help you if you have thoughts like that communicable illness or other things that you want to start trying to collect within the platform. We would love to help you navigate that and provide the best way, help you build out maybe a template to best collect that in your environment.
Laura, I would love to do a push, or not a push, but a recommendation too, that remember we have office hours for our current clients every other Wednesday. So it'll be next Wednesday for the health and physical health. Please come and we can talk about reporting in our office hours. So if you need more information about that, email success@augustschools and we'd be happy to get you the registration link.
Perfect.
All right. Thank you, Bethany and Laura. Thank you, everyone, for joining today. There I am. And if you have any questions or comments or anything you'd like to ask us about, you can email us at hello@augustschools.com as well. So I'm sharing that in the chat. And have a great rest of your day. Thank you, everyone.